Hi everybody, my name is Mike Dale. I'm the Executive Director of Century Tree Health Education, the producers of The Big Generation. I'd like to talk to you about something that I'm sure you're all aware of and concerned about, coronavirus. The first thing that's important is safety. When you go outside, there is consensus that we all should wear masks, and I'd like to do some training right off the bat. You'll notice in this, which is a fairly typical mask, there are loops on either side. Here's the right loop, here's the left loop. They are not interchangeable. Hook the right loop around the right ear and the left loop around the left ear. It will greatly enhance your safety. There's another thing that's extremely important that many people don't know about. Hand washing is very important. Now, there's a secret trick to washing hands. It's not just simply washing your hands under a faucet. 15 seconds is the benchmark. Coincidentally, an old nurse's trick. Sing happy birthday twice. Happy birthday to you. Happy birthday to you. Happy birthday, dear Michael. That's me. Me. Joke. You can sing it to yourself. Okay. Now we're going to get just a little more serious. You may be realizing something. I don't know a whole lot more about coronavirus than you do. And that very likely is the truth. I mean, I probably know more about the pathophysiology. I may know more about how the medications work or don't work. But the truth is, most people are pretty well versed on what to do about coronavirus and what's being done in the news. And many people listening probably know more than me. So I'm not going to do that. There are millions of other places you can find information. You can go to the CDC is a great place to start. So we're going to deal with all the other stuff that everybody's forgetting about. I mean, it's just crazy now because this is going to come as a surprise, probably as you haven't thought about it. Coronavirus does not cure other illnesses. You can still get them. So we're going to be talking about stuff like high blood pressure, heart disease, heart failure, type 2 diabetes, COPD, and some real difficult ones like dementia. Now, you're listening to me talk about stuff like hypertension, which is high blood pressure, and heart disease, COPD, which is a lung disease, diabetes, which happens because you eat too much sugar and don't exercise for long periods of time if you also have a genetic predisposition, which means it runs in your family. Here's the thing that I want to tell you. Lifestyle, exercise, healthy diet, being sensible. My advice. Do what you want. Nobody's going to listen to me about that. I mean, look, it's good not to eat, say, Lucky Charms more than once a day. I try not to. Although I have discovered these bean pies that you can get that have these really sweet bean stuff around this gummy thing around the side that taste really, really good. And the problem is I started eating it for breakfast. And the problem with that is, well, for a long time I was just eating one. But, I'm feeling kind of stressed out. So I'm now eating 2 for breakfast every day. And then I get to the afternoon. And in the afternoon I'm eating another one. And then I have a 4th one by the time I go to bed. And that is 1,200 calories. So this is my first piece. Well, my third piece of medical advice. Correctly administer the mask, sing happy birthday when you wash your hands, and eat less than 4 bean pies every day. But you're going to do what you're going to do about that stuff, about eating correctly, about exercising, about living sensibly. This is a really difficult time, and now I'm talking really seriously. It would be better for you if you did. But I'm not going to sit in judgment of anybody who doesn't, especially since I am eating 3 or 4 bean pies a day on a lot of days. Do your best. There is one thing that we really are going to push very hard on this website. Pills. I'm going to come back to them, not in this episode, but we're going to talk about pills a lot because pills need to be taken. And it's harder to take them because it's harder to Get your prescription filled. If you're feeling depressed, it's harder to just take them every day. It's harder to get a hold of your doctor if you need a prescription renewed, all that stuff. But that stuff really makes a difference with your health. That stuff keeps people out of the hospital. And you want to stay out of the hospital right now. There's only one other thing that I want to talk about. Loneliness. You know, it's interesting. I watch, there's a big sort of push on the internet right now, depending on when you happen to be listening to this, about how hard it is, and quarantine isn't a competitive sport, which is a great point. You know, doing everything right, you know, teaching yourself to learn French and writing your novel and keeping the house clean, you know, great thing to do. But let's face it, people are sad and lonely, and that we need to really pay attention to ourselves and not be too demanding of ourselves. And I totally agree with that. But, you know, there's something I'm always troubled by that, and that's that they always describe being sad and lonely during coronavirus and being depressed kind of romantically, as if you're sort of haunted of soul, gracefully sitting lonely in your house. And my experience is that it's not like that. Feeling bad is clumsy. It's filled with shame. It's disorganized. It just feels bad. You feel bad. You feel ugly and unattractive. So if that's happening, first thing is give yourself a break. And the second is, maybe as we move on, we'll be able to find ways together to do something about that. And I'm going to start with one thing. There's something that we're really big about here. Two things, actually. The first one is the telephone. This site is really for people over 50 who use telephones. We didn't use Zoom. We didn't use Skype. We didn't use all the things I'm not mentioning because I don't know what they are. We're going to encourage people to find ways that they can use the telephone to talk to their friends and also to strangers. And I'm going to start just by doing this. If you feel like talking for 5 minutes, call me. My phone number, 718-755-9384. 718-755-9384. And maybe we can sing happy birthday together. Thank you very much. I'll be back in a couple of days. And hang in there.